So we wanted to kind of broaden out this discussion here because we hear time and time again when we talk about these cases, you heard the woman there tell Tradisha Woodard, get out while you can. Trust your gut, know that it's time to leave. But you want to make sure, right, that there are resources when people do make that decision to leave a situation. We have Kathleen Lockwood, who's joining us from North Carolina Coalition Against Domestic Violence. Kathleen, you're the policy director. And we thank you again so much for joining us tonight and taking the time to speak on this important topic. We wanted to bring you in just because we do hear, the fact that there is a need. People need resources when they are trying to get out of these situations. But we want to make sure that the resources are robust and they're there. So how is the picture looking like in North Carolina? Are y'all still needing more resources, and how are you going about things if so?
Absolutely. So in North Carolina, we have domestic violence service providers that provide services in all 100 counties in the state. They are funded through a variety of sources. Some of that is state money, some of that are some different federal funding, as well as local funding and donations. Programs have seen donations go down since COVID and unfortunately not return. And while state money has been helpful, it's really been fairly stable for many years now, while we've seen the demand for services increase. So domestic violence service providers from 2018 to 2023 saw a 51% increase in demand for services. And at the coalition, we often hear from advocates kind of the picture behind the numbers, and they shared with us that during that time period, they're also seeing folks present for services with much more escalated violence, so much more dangerous situations, unfortunately, which means it's more resources that they're devoting to helping each person who's presenting needing help in our communities. And unfortunately, we also see that bearing out in an increase in domestic violence homicides in recent years. We know this is a problem that will continue to be present in our communities, and it's unfortunately just becoming more and more dangerous as programs aren't necessarily having all the resources that they need to meet the demand that's coming in their doors.
I mean, it's really tough to hear, as you characterize there, not only is it more of an issue, it sounds like you just kind of characterize it as things are getting more aggressive and more damaging, impactful with each case. And I mean, we here in the Charlotte area have covered, several of these cases so far this year, I feel like. And I mean, talking about the resources, I know that y'all have tried to get together as these groups to kind of advocate for more, if there is more to be had. I know that recently you had a special day actually back in April where y'all went to Raleigh and tried to speak with lawmakers. Tell us about that effort. How did that go? Do you feel like you got the response that you wanted? Is there more that you felt like could have been done?
Yeah, so we partnered with the North Carolina Coalition Against Sexual Assault and Child Advocacy Centers in North Carolina to bring the story of victim services to Raleigh and let them know how important our work is and how much we still need to be able to meet the growing demand for services. So we had a number of domestic violence service providers who took time out of their very busy schedules to educate their lawmakers and talk about what they needed. It was, from the participants I spoke to, a really fruitful conversation. They really felt like lawmakers understood how important their roles are in our state. We know that lawmakers are really struggling with a lot of demand for state money, especially with Hurricane Helene happening in our state. And so they're having to make some really tough decisions. And we asked them on that advocacy day if they could provide us with $10 million in annual state funding in addition to what we already received to make sure that our programs can stay stable as federal funding may be rocky in the coming years. We did, like I said, get some good responses from lawmakers who really seem to understand the issue. The state budget is still very much being negotiated, but we have seen in the Senate's draft of the budget as well as the House draft of the budget that they would increase a source of funding that goes to domestic violence service providers in the form of marriage and divorce filing fees in our state. And that would allow those programs to receive about $4 million extra a year distributed throughout the programs in the state. So we understand it's not $10 million like we asked for, but $4 million each dollar can really help make sure programs stay open and continue to help each person that comes in their doors. So we're grateful for what we can get at this point, and definitely grateful that lawmakers are prioritizing this with the limited funds that they have available to distribute in our state.
Is there anything specific about the climate right now, or just, certain influences in general that are happening that you feel might be behind some of the trends we're seeing with domestic violence, the increase in severity in cases, or the fact that we just have a higher demand? I'd heard at one point, from one group, perhaps maybe the economy sometimes can play a role, but I feel like that's probably just one factor of what might be many things.
Yeah, so what we know about domestic violence is that stress within communities and within families is often felt in that domestic violence relationship. So those stressors often can be economic stressors. So when the economy gets tight or unstable, individuals feel that in their paychecks and the price of groceries, and they'll take that stress home with them. And if they don't have the coping skills or the good example of healthy relationships and how to manage stress, that can come out in the form of domestic violence. In the same way, if we see political unrest in our communities or stress related to natural disaster, we also see domestic violence increase around that. And so we know that we're living in really stressful times in the state and in this country for a variety of reasons. And unfortunately, that is bearing out in increases in domestic violence. We also know that the presence of a firearm in a home increases the likelihood that domestic violence will end in homicide by 5 times. So if there's domestic violence in the home and a firearm is present, we're more likely to see death by firearm be the result. And unfortunately, when we look at the numbers for the increases in domestic violence homicides that I mentioned, in 2024, we saw a record number of 94 domestic violence homicides. I believe it was over 80% of those that involved the use of a firearm. And when we look at the increase in domestic violence homicides in the last few years, we really do see that increase correlating also with a graph of the increase in firearm possession in our state. So it's a combination of all of these stressors in our community making domestic violence happen, and the increase of firearms making it more likely that domestic violence will lead to death, unfortunately.
Now, I'm curious about the actual needs to address the issue, what's out there. And I think back a couple of months ago, I had done an in-depth look at the relationship between violence against people and violence against pets. And one of the aspects that I explored with that topic was how folks will probably be surprised to see that not all domestic violence shelters can accept pets, and sometimes that can make a difference with someone making a decision: do I leave a situation and leave behind my pet? And obviously there are some shelters that try to get around that with other ways, like a fostering program, or they have a safe place for the pet to go separately. They don't get to stay with their owner. But so I think about that as being one need that I was had my eyes open to that existed out there. But is there anything out there that you see as just a really big need that y'all are like, it would be great to have this addressed sometime soon?
Yeah, I could go all night with a long list of needs, but I think you bring up shelter, and that really reminds me that not all communities actually have a domestic violence shelter, unfortunately. And those that do, we have heard from those programs in recent years, they're often full for up to half the year or all of the year. So when someone calls in crisis and they're looking for somewhere to stay in their choice to leave a domestic violence relationship, there may not be emergency domestic violence focused shelter available for them. We've also heard from domestic violence service providers that as the affordable housing crisis really is ramping up in all types of communities, rural and urban in our state, folks who are in shelter are having a lot harder time finding a place to go after shelter, which which means they're staying longer, or when they do leave, they're facing the choice of being unhoused or living in a homeless shelter with their family, or returning to a home environment that feels very dangerous to them. So when we look at kind of tackling some of these other issues in our community that are difficult and add stressors, that also is tackling helping folks responding to domestic violence. You mentioned pets. You know, pets are often a reason that people stay in unsafe situations in the same way that children, and the ability to pay for a roof over your head are also reasons that folks stay in situations that otherwise they would leave because they're unsafe. So ways to make sure that our families and everyone in our community has the ability to make a living wage and to keep their jobs is also a way to keep our communities safe from domestic violence, homicide as well.
Such a multi-pronged issue. I'm just wondering, is there any research out there, or, any ideas about preventative, I guess, if you will, preventative measures, to get ahead of the issue, either before a person maybe becomes violent, or before a situation perhaps even escalates to that point?
Absolutely. So the Center for Disease Control at the federal level has published a lot of really great research and continue to fund prevention work across the country. NCCADV, where I work, actually has a program and multiple staff focused just on this issue, researching and promoting prevention strategies. Some of the things that we've learned along the way and been promoting is, like I mentioned earlier, talking about healthy relationships from a very young age, making sure that folks growing up in our communities have access to stress coping mechanisms. In addition, we talk about societal or community level prevention factors, so things that decrease stress in a community or make it easier for folks who are experiencing unsafe situations to find resources and support in their community before it turns into escalated domestic violence. So some of those things are called protective factors in our community. So things like strong community cohesion. So even just knowing and being in supportive relationships with your neighbors can actually prevent domestic violence, because it allows for relationship to reduce stress, and it also allows for folks to have a place to go when they need to just kind of work out some stress or take a moment away from one another if things are escalating in the home. In the same way, paid leave is something that we talk about as a prevention factor. If folks have access to paid leave to help them build stronger relationships and family-child relationships when a child is born, that child is less likely to experience domestic violence, and their parents have a lot less stress when welcoming that child in the world, which also prevents violence from happening in that relationship. So you mentioned it's a multi-pronged. There's really great public health research that really gets into those prongs and kind of makes connections that we ordinarily wouldn't think of as domestic violence prevention, but actually do stop the violence from happening before it starts. So programs like going into schools with this prevention work and domestic violence programs, those direct service providers that I mentioned often have those prevention programs and work in their community to do that. Some of the funding challenges that I talked about earlier have led them to have to cut those programs, or to be concerned about future staffing needs around those programs because they aren't considered core. So when we fund our core services, it allows those programs to also focus on prevention measures so that maybe they won't have as many folks coming in the door asking for help once it's already a violent situation, and we can focus instead on keeping our communities healthy and safe from the jump.
Now, you just mentioned the fact that, it does feel maybe a little bit uncertain or rocky with, what funding might look like in the future or going forward. I guess how are y'all, as advocates, feeling about the situation? Do you feel optimistic that, eventually this will be a short patch that eventually you'll get over, and maybe more funding will be more, certain down the road? Or does this feel like something that you'll really have to keep fighting for, keep pushing for in the future?
So we consider this a long-term need. We have, like I mentioned, really great support at the state level in recognizing the need for increased funding. Unfortunately, we're not sure yet if we have that same support at the federal level. The fiscal year 2026 budget negotiation process is really in its early stages. All that's happened so far is that the president has released a budget proposal that he suggests to Congress what he'd like to see in the budget. And unfortunately, his budget proposal suggests cutting funding under the Office of Violence Against Women by $200 million across the country. So we are in an environment where we need more, and we may be looking at less in the near future, particularly with this current administration, if those continue to be the priorities coming out of the federal government. We also know that there have been reductions in federal funding for many years now, unfortunately, under the Victims of Crime Act, which has led programs combined with that increased need to really be working on shoestring budgets. And so we're really concerned that if there are additional cuts from the federal government or any delays in federal funding making its way here to North Carolina, it will literally result in some programs having to close. And when that happens, the nearby programs kind of take on that role, and they're continuing to do more with less as well. So we are really kind of sounding the alarm that this is a crisis right now before we get to the point where programs close and there are even less resources available to our community. And we're buckling down for this to be kind of a long-term discussion with our decision makers and within our communities about how do we plug these holes that we see coming in funding, and how do we also show up for all of our community members in new ways that might not be as funded the same way moving forward.
So given all that you've said there, if folks are watching at home and they say, A, I want to learn more about this topic, how can I become more educated about this? And B, let's just say someone says, I want to help, what would you recommend that they do?
So I would look into your local community, who are the service providers there. A lot of times those needs are really specific to where you are. You can go on NCCADV's website, which is where I work, nccadv.org. We have a Get Help page where you can put in the county where you live, the counties nearby, and it lists out who those service providers are. You may want to reach out to them and see if there's anything they need as far as donations or as far as volunteer support to kind of help them keep going. And if you have the financial need or the financial ability, this is definitely the time to consider contributing to those local resources. And then engage with your elected officials at the state, local, and federal level. Let them know that this is a concern you have and that you're watching to see how they address it. Because I go to Raleigh regularly. I'll be going to DC next week to talk with our lawmakers, and it's always important and helps me a lot if I can say, and they know, like, you're going to hear about this when you're at home in your district. Like, this is something that actually matters to your community, not just something that matters to me personally. So for folks that are concerned, kind of be a part of that conversation, lifting up that this is a need that you want to see addressed.
Anything else that you'd like to leave our viewers with before we wrap things up?
Just if anyone is in need of services themselves after hearing this, that Get Help page I mentioned on NCCADV's website is a great place to learn about the resources near you. You don't have to be a resident of a county to access services there. So just reach out and have a conversation if you think that would be helpful for you moving forward.
Kathleen Lockwood, thank you so much for your time. Once again, folks, you can find more information too at the North Carolina Coalition Against Domestic Violence website. And we just so appreciate you taking the time to have this conversation. And we do hope that you come back and join us here on Live Impact News. Give us any updates as your efforts go, or if there's anything you feel like we need to highlight for our viewers going forward.
Thank you so much.
All right. Take care. And we'll remind folks, too, as well, another resource, we wanted to make sure that you knew that there was also a domestic violence hotline that you could either call or text. So the number is 800-799-7233. And then there's the text line. You could text the word START to 88788. But as Kathleen just mentioned in our chat just now, there are some local resources as well. So a wealth of places that you could go to try to get the help that you might need. But the hotline there, as you just